Well, hi, everybody. Welcome to Habitual Excellence. I'm Mark Graban from Value Capture. And today we have a returning guest. He is Dr. Eric Dickson. He's the president and chief executive officer at UMass Memorial Health. He was our guest in episode 11 that was released back in July 2020, much earlier in the pandemic. So first off, Eric, welcome back to the podcast. Thanks for joining us today.
Oh, thanks so much for having me, Mark.
First question, we're going to follow up a bit on the last episode and cover some lessons learned that you've experienced. But, first off, as we record this on December 23rd, 2021, how are things at UMass Memorial? How are things in your communities?
Well, it's hard to believe here in the most vaccinated state in the country, with really 90% of our population vaccinated, we're dealing with a third surge of COVID that is about 3/4 of the peak of the previous surges, with no clear end in sight. But the team somehow is once again rallying and taking care of patients and taking care of each other. And it's just humbled to be a part of this team.
And hopefully what's going on is more of an impetus for the remainder of the communities to get vaccinated.
Yeah, it's very clear that this is still a pandemic of the unvaccinated. Despite being the most vaccinated state, more than 75% of our inpatient hospitalizations for COVID are unvaccinated individuals. So go out, get yourself vaccinated. If you already got vaccinated, you're due for a booster, get boosted. We almost see zero hospitalizations from patients that have, as we say it here, got their booster. And that's what I hope you'll all do to keep yourself safe.
Yeah. Well, thank you. Thank you for that, Eric. Following up on the last episode, the last conversation, you had shared, and I really appreciated and admire this, the no furloughs, no layoffs commitment. How did that play out beyond July 2020?
Might have been the best decision we made. And that, this was scary for all of us, especially early on, and we didn't know what was going on. And as we started to shut a lot of things down that are revenue producing, we started to see the red ink. And we had been talking for years about a culture of respect for people and taking care of our people. And this was our chance to put our money where our mouth was. But little did we know then that our recovery after the surge, because we hadn't laid anybody off, we hadn't done any furloughs, and we kind of became the employer of choice for the region, allowed us to recover very quickly. And in both fiscal year 20 and 21, we were in the black. And that is not at all what we expected. It would have been really hard to have terminated people or laid people off, and then later explain why you did that in a year that you made money. So if I had it to do over again, I'd do it the same way.
Yeah. Well, thank you for sharing the reflections on that. And it sounds like, if there was another crisis, same decision, same commitment to the people.
Absolutely.
Yeah. So it's been almost 2 years here. I know you've reflected quite a bit, and have some thoughts to share with us in terms of lessons learned about whether you frame it as lean management or leadership or looking after and developing people. What are some of the key lessons learned from this crisis?
There's been a lot. I think you have to start with the kind of what's your management paradigm? What's that mental model in your head when you think about what your job is as a leader to start with, and then adjust that to kind of a crisis situation. And I was so lucky that early on in my leadership career, somebody planted a mental model in my head that still works for me. And that is that your job as a leader is to move your department, your piece of an organization, or in my case, the entire organization, from where it is to where you aspire it to be. That a better place. And for us, we always talk about the perfect patient experience and a perfect caregiver experience. Best place to give care, best place to get care. And that the job of leadership is to engage every one of your people every day in continuous daily improvement and moving towards that better state, and constantly messaging what that better state is. And as you work with your people, you're developing them into problem solvers, and the better problem solvers you have, the faster you can move. And as you listen to your people and their ideas about how you can move from where you are to where you want to be, they feel respected, they feel valued. And there's nothing more important than your workforce feeling valued. And I talk a lot about I want them to know I love them, right? That I care about them, and I do. And I have a lean coach that was in Toyota for 20 years, and she says, "That's not lean, right?" And I said, "I don't care. That's me, right?" And but it is respect for people, right? Do they feel like they have something to contribute? And when a crisis hits, you have to make some adjustments, right? Are you still talking about best place to give care, best place to get care? And in some ways, what I always say, a crisis is a sudden deterioration of your current state, and you then have to lower your short-term expectations and set goals for your organization that are going to get you through the crisis. And so when we went through the first surge, it was about getting PPE for our employees, right? So that they could be safe. It was about creating surge capacity and creating a field hospital that ultimately took care of 1,000 patients. It was about bringing in additional workforce to help staff those places. And I think when you move into a crisis state, you've got to adjust to short-term objectives. And then you have to empower individuals to make the decisions to get those things done. And I said to the person that I put in charge of creating the field hospital, "You are the CEO for this project. You make whatever decision you have to make to get this done, because you only have 8 days. That's what we had the first time. And you don't have to ask anyone's permission. If you have to, you just say, 'Eric said.'" And they did an amazing job. But I guess the part that I didn't quite realize at the time is, in giving people these tasks and the authority to move forward, and they work their tails off, boy, did I develop some problem solvers through all of that. They emerged out of that with this sense that they could do anything. Sometimes it was hard to put them back into the cage a little bit, because they want to move that fast all the time again. And I guess one of the biggest learning lessons for me is that a crisis is an opportunity to develop your people. It's a super opportunity to develop your people, and don't miss out on that. And there was a few situations where I put the younger person that was going to likely be with us for a longer period of time instead of the more senior person in charge of a project, because I was thinking, that person's going to retire next year. Am I really want to focus this opportunity on developing them? And I think much more about, who's that up and comer that I can put on this, because it's just, when they succeed, it'll carry them forward and the whole team forward. And we emerge from each of these surges stronger. I hope that's the case with this one, because people are exhausted, but it is a real opportunity to strengthen the ties between the team and to develop your people and to come out stronger. With every crisis, there is opportunity. And I think the biggest opportunity for us was a chance to develop leaders.
So a couple follow-up questions from that. I mean, I could see where oftentimes in a crisis, people might say, it's such a crisis, we don't have time to develop people. I need someone who's got the right answer right away. And there's, this question of finding the balance of developing people versus solving the problem, developing your own solutions versus there's often temptation likewise to go grab something quote unquote off the shelf. Did you have conversations with other leaders to find the right balance that was most effective?
Yeah, it's a great point, Mark. And I think, being a faculty member in an emergency department and teaching emergency medicine now for a couple decades, you have a patient that comes in that's critically ill or injured, right? You've got your resident with you, and that resident at some point is going to have to be in an ER on their own and deal with this exact same patient. And but at the same time, I'm the most experienced person there, and perhaps getting an airway and maintaining it. And so, in training physicians, we're constantly having this. All right, I want this person to develop because they're going to have to work on their own. And if I just do this myself, I might not, I'm setting up some patient for 5 years from now that's going to be in trouble because this resident didn't get that skill that they need.
Wow.
And I think there is a way to carefully allow that person to develop, allow that person to make the mistakes, while at the same time to be there for them. And I think the worst situation is, and this happens in academic medicine, when you say to somebody, a junior person, call me if you need me, but it's a sign of weakness. And what I like to say is it's a sign of strength, right? I want you to do this on your own as much as possible, but if you need me, I'm going to be here. And ultimately, it's a sign that you're willing, of humility, and don't worry about calling me and asking for help. And so I think that that's the balance, that you put them in charge, you give them the project, you allow them to make decisions. And part of selecting the right person is selecting the person that knows when to call for help and when to try to do it on their own. And they just get better and better at it. So it is something that you have to take into consideration. There is a safe way to do it. And ultimately the rewards for having a great problem solver, a leader that has more confidence in themselves because they just turned a convention center into a field hospital with, an ICU bay. I mean, that's priceless.
Well, and what I hear coming through loud and clear from what you're saying is, decisions that are principles based. Principles including providing the best care, a principle of developing people, a principle of, one way of putting it might be, doing the right thing for the right reason. I was wondering, if you could elaborate one other illustration of that. I think you referenced back in the first surge, the need to provide PPE to help people working there feel safe. So how did short-term objectives driven by a crisis, what sort of response did that lead to?
It's interesting that your values don't change because a crisis hit.
Yeah.
And
right.
But if you can strengthen your culture during it. So I must say, like when this first happened and we were talking about, we had all these people standing around doing nothing really. And the really good one said, let's work on clinic redesign. Since we're all here, we're all available, there's no patients here, this would be a good time to kind of figure out how, when the patients come back, we want to do things. That's the best opportunity. But, you're looking at potential red ink. You're thinking about how you can reduce expenses. And you talk about respect for people for so long. It is like, it was a little tough, I have to admit, the first time when we decided, and it worked out for us. And the same with the PPE. We spent a lot more money than a lot of other organizations on PPE because we were willing to pay the extra to make sure that our people had what they needed. And now similar situations have come up. And just this Monday, we had our core team meeting. And we needed to prepare for another big surge, and we didn't have the staff we needed. And there was a nursing agency that could get us nurses, and it was 3 to 4 times what we would typically pay for a nurse per hour. And we're all looking at each other saying, we don't know what the peak of the surge is going to be. If it gets worse and we don't have them, we're going to be in big trouble. The patient's going to be in big trouble, but it's going to cost us another $5 to $10 million to bring these folks in. And having made those decisions previously and had them all come back to us in spades in many ways, and being happy we made the decisions, the team just looked around and said, "Yeah, we got to bring him in, and we'll figure out the money later." And I think that's a big leap for an organization to start to say, we'll do what you have to do to keep your people safe, to keep your patients safe, your customer, and you just have to figure out the money later. And that in a crisis, you can't always act in that way. And it's just like this has solidified our culture for us. I even had some of my medical school professors come up to me and say, like, all that stuff you've been talking about all these years, it took this crisis to cement it in. And, these are people that have known me for a long time. I carried their charts. I often use the example because when I was going through med school, we had paper charts. And, one of them said to me, "We were always rooting for you, Eric. I just don't think we believed all that, right? But you were right. You were right. We all need to become better problem solvers." And so I find the job now almost easier because all of the stuff we did for the years of training everybody in lean, like every new employee, and that's expensive, and standards of respect, and how everybody has to go through that training, and taking people off the line. And now nobody's questioning at all whether or not we got a return on investment in that. But it took a crisis for us in some ways.
Yeah. So, and then there was a time where you also had to use your word, overpay for supplies when masks and gowns and face shields and things were in short supply, right?
Yeah. And it's, I hate overpaying for anything. I hate overhiring because it puts us at risk sometimes at having too many people. And then you're in a situation where you have to move people, you have to cut people, so I have kind of a farmer's mentality in that I always, like, regardless of what the finances are, like to act like the resources are scarce, and that keeps us out of trouble from ever having to make decisions that impact people. But when it comes down to keeping your people safe, they have to know that you're doing absolutely everything you can to keep them safe. We had at one of our hospitals one of our wonderful nurses that was stabbed by a patient, and thankfully she was stabbed in the ER. She was an ER nurse, and I say thankfully because she would have made it if she was stabbed anywhere else, given the nature of the injuries.
Gosh.
And the nurses said, "We want metal detectors in the ERs." And we priced that out, and it was millions of dollars because you have to have the metal detector and a security guard. And then we said, "Oh, what's that say to the customers that they're coming into the emergency department and all that?" And then we just, we said, "Look, this is what it's going to take to make our people feel safe until there's a better solution." And I can't tell you how many thank yous I've received from the nurses and the docs that work in the emergency department, because it was just shocking how many weapons we were taking off people that were entering into the emergency department. And that's another one where it's like, it's hard to spend the money, but if that's what your people need to feel safe, spend it. It'll come back to you. It'll come back to you in engagement. It'll come back to you in productivity. They'll partner with you on solving problems, and it'll be worth it. You got to keep your people safe. That's something Paul O'Neill taught me a long time ago, and it just doesn't matter. You have to keep your people safe.
Yeah, I mean, and I think there is a lean principle around doing what's necessary. If that's now the reality of needing to screen out weapons, that's a cost of doing business. There are ways then to take out cost to make up for it. I think, as you articulated, increase morale and productivity, engaging people as you've done, everybody, every day, improvements to take out waste, to allow you then to afford the things that are sadly necessary.
It always comes back to that same paradigm for me. If you engage every one of your people every day and often taking out waste and moving you closer to that desired future state, you have such a competitive edge over most of the companies you're competing with that fail to be able to do that. And one of the costs of getting that engagement is obviously them feeling that they're safe, that any little downturn of finances isn't going to get them laid off, especially with a pandemic going on. And you just have to believe it yourself that what is an engaged employee worth? What is it worth to have an engaged employee? And I had a good friend who a little statue of him, a bobblehead behind me. He built $1 billion enterprise in and around Worcester, and our emergency department is named after him because of our donations. And he used to say to me, "What's a pound of steak cost?" And I'd say, "I don't know, $10 steady." He goes, "And what's a pound of sizzle worth?" And he said, "Priceless." Right. Yeah. And it was the sense that the sizzle is the engaged staff, the people taking pride in the product that they're creating. And he had everything from a bank to restaurants to selling cars. And he said, like, in every single one of those, like, he would talk about, you got to have sizzle, and that's your people loving what they're doing and feeling like you care about them. And what's that worth in any industry? I don't think you can put a price on it. It's certainly worth some metal detectors in your emergency departments to keep your people safe.
Yeah. So Eric, I'd love to hear some of your thoughts and what happened regarding, building on, again, principles and values around safety, taking care of your people, respecting your people, loving your people, as you said. When it came to vaccine mandates, can you share a little bit about some of the conversation with employees and the decision to do that?
Yeah, we did have a vaccine mandate, and we do have a vaccine mandate for COVID. And it's one of the most painful things of this whole pandemic is we terminated 220 employees for not getting vaccinated. And for me, that was 220 failures and on us. 220 people that we couldn't get to see the importance of getting vaccinated for themselves, for their families, and certainly for our patients. And so as we considered the vaccine mandate and how we were going to do this, the conversation, the primary conversation was respect for people and how we would, what does that mean when you're talking about this vaccine mandate? Because it would seem like, well, we're not going to terminate anybody for not getting vaccinated. That's respect for people. Or we're going to make sure that your coworker is vaccinated so you don't get infected. That's respect for people. Or we're going to make sure that we don't infect our patients, or our patients don't get our employees infected by. And so it's probably the one time where the answer to the question, if you were the organization that respected their people more than any other organization in the world, what would that organization do? And we struggled with it. And we never got to consensus amongst the leadership team on should we do it, shouldn't we do it. But we made the decision with our eyes wide open and asking one question, like, what would the organization that shows respect for people more than any other organization on this planet do? And we did decide that the best thing for our patients and our other 16,300 caregivers that work here was to mandate it and to the point of termination. But even with the terminations, and I knew a lot of the people that got terminated because I've been here for 30 years, and I said it to them, we love you, we'll take you back, but we feel that this is the best way to protect our people and our patients. And so we're really sorry this happened, and there's no hard feelings. give you a reference, a good reference. This isn't whatever you need, but this is, what you have to do. And I think, we had a lot of people that ultimately got vaccinated, and then someone in their family wasn't vaccinated, got sick, and they said, "Geez, you might have saved me," right? And I think we actually saved some of our employees' lives by making them get vaccinated. And but it was kind of a failure that we couldn't convince them all, and that we had to lose any, because we could sure use those 220 people today.
Mhm. There was a similar framing. You talk about mandate, but you also talk about the responsibility to try to educate and inform people. And I'm sure there were a lot of conversations with people. There was a similar framing in a webinar that we hosted early December, a group from Legacy Health out in Oregon, who articulated that in a very similar way, of like when it did come down to letting some people go, similar percentages, small percentage, they kind of likewise framed that as a failure, that they were trying to reach people and listen and talk with them. And, for different reasons, as we see around the country, there were some employees who held to their decision to not get vaccinated. Can you share a little bit more about, just efforts to have conversations with people about why you wanted them to make that decision to get vaccinated?
Well, it's interesting. I have one case that just stands out in my mind the most of all of this. It was a long-term employee, and she had some health issues, and had read and heart-related health issues, and had read that the Pfizer and Moderna can cause cardiomyositis and such, that she was worried about her heart and getting this cardiomyopathy from the virus potentially. And she had that before, and it had left her in a weakened state. And nicest letter, and and I read them all, and it takes me into the wee hours in the morning sometimes. But what she said is, "I'm so scared to get this vaccine, but I'm scared not to get it because I don't want to get COVID, because I'm vulnerable as well." And so one of our chief medical officer, who's just a wonderful, wonderful human being, spent 30 minutes with her, went over the pluses and minuses, and she ultimately chose to get vaccinated, didn't lose her job, and did fine with the vaccine, thank God, and showed her the data that it was actually young males get the cardiomyopathy from this, and it's self-limited, not older folks, and took that time. And I was just amazed in seeing him, and I just thanked him profusely for caring that much about that employee, who was ultimately glad she got vaccinated, because she was very high risk if she got infected. And then we had a lot of folks that employees of color that had a lower vaccine rate and mistrusting of medicine. And certainly if you're African American, you have good reason to mistrust medicine if you look in the history of the field. And so we spent a lot of time figuring out who do they trust, and truly understanding why they didn't want to get it. And it was mostly a knowledge gap in understanding how it works. I heard about this gene therapy thing. Am I going to mutate? And, because of it. And there's just so much misinformation out there. But it was in part figuring out, who they would at least listen to and believe in. And we made a lot of progress there. But it's thinking about it, it's like, what's the root cause of the problem, right? And like, and what's the root cause of these individuals not wanting to get vaccinated? Because all of your efforts around anything else but that root cause is really a waste of time and not going to convince them. And so we had to listen first before we could really start to educate. I think a lot of times we rush in and say, here's the data, boom, 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 boom. This is why you should get vaccinated. And instead of asking the question, what do you worry? What fears do you have about the vaccine? And this was what I was worried about at first, right? I had never heard of this. Were you worried about that? And if they feel like you're listening first and then showing them data and then still respecting their decision, you're more likely to get them.
Yeah, and what you're kind of explaining in that story is, I think, illustrates when people say we should use the word hesitancy in most cases as opposed to resistant, where somebody who's hesitant, as you said, they had reasons to get vaccinated. They have reasons, they think, to not get vaccinated. There's at least a starting point for a conversation, and hear them out, let them articulate that. And I mean, the little bit I've learned about counseling over years, it's more a matter of letting that person convince themselves as it is you convincing them.
But it's so true for any problem solving, right? If you have a standard process and you have somebody that's not following the standard process, your first, if you walk in and say, I need you to do it this way from now on, right? Geez, maybe you have a better way. Maybe you have a better way. Maybe your way should be our standard process. And being open to the fact that understanding why wouldn't they want to follow the standard process if it was perfect or really good, and instead of just coming in and say this is the rule, you need to follow it. And it's no different with dealing with vaccine hesitancy.
Yeah, that's a really, really good point there. Eric, maybe one last question here, looking forward a bit. You talked earlier about how staff are exhausted, and that's a really widespread problem. And people are going to be leaders, and their employees are going to be trying to figure out how to recover from that exhaustion. Have you started having conversations with people about some things that you might do to help in that recovery?
We have, and it's probably the biggest concern we have coming out of this is that just how much people have been through. We have already a significant percentage of the healthcare workforce has retired or left healthcare, and that's having very negative ramifications on the industry as a whole. And I think there's a couple of things that we can do that make a difference. And first, you got to see leadership out in the areas where the stress is. I spent yesterday all day at one of our community hospitals. It's a community hospital that is getting hit the most with this surge, and just walking around and talking to our nurses, our doctors that were caring for patients, went in the COVID units, had to bring all my stuff to be ready and with them, and just telling them just like how much I appreciate it, but how much the community appreciates it, and helping trying to attach them to the mission. And we're very fortunate in healthcare that when you really think about what we do, and sometimes you forget, it's like people are coming to us at the very worst times of their lives and asking for help, and we help them, and we save lives every day in this organization. That you attach yourself to that. That's outstanding, an outstanding way to prevent burnout. And I don't know how Mother Teresa never got burnt out, but it was always being attached to saving those children. And so this constant reminder here in healthcare of what we do and why it's so important. And then there's a lesson I learned a long time ago about the power of you helping someone else that's going through the same thing with you. And there's a very fascinating book about going through Naval SEAL training, and it is the candidates that pick someone that they're going to help and get through that are most likely to get through themselves. So in helping someone else, you elevate yourself. And so we've adopted this philosophy of be somebody's best friend at work. One of your co-workers really needs you, and don't just take great care of our patients, but take great care of one another. And we have a couple of experts in the medical school on this, and they said, they did a video that says no kale latte or yoga class is going to fix burnout for what you're going through right now.
Right.
But helping your fellow caregiver get through is the key, and that's a big part of what we have focused on. But when things are going poorly and you're in a leadership role, you got to get down there with your people. There's no meeting more important than actually being down there where the pain is and understanding that. And another Paul O'Neillism, right? When things are going right, you probably don't need to be there. When things are going wrong, they need to see you. And that's been my philosophy, and it's helped me a lot in my leadership journey.
And it seems like a lot of other organizations are going to have to put in a lot of effort to rebuild trust. And it seems like from the decisions that you've made and the approaches that you've taken, that hopefully there's been less erosion of trust. If anything, hopefully that trust has been strengthened, which sets you up better for recovery, it seems.
Absolutely. And especially now, I think, that people that just right now are saying, oh, we better really start to take care of our people because they all have lots of options on where to go right now, right? It's a workforce's market right now, and the employers are the one that are struggling and competing with each other. And I just think of all of the things we did for our people these last 2 years,
right?
And even before that, but it was much more apparent these last 2 years. And think that, I'm going to have a competitive advantage in trying to retain and recruit new people. I mean, right across the street from us, and I wouldn't wish this on my enemy. The CEO of the hospital down the street just finished a 9-month nursing strike. I think it's the longest strike in U.S. history. This is 3 miles down the street, and I can't imagine being in her shoes right now and trying to rebuild that relationship and have people want to choose to have to come work for you coming out of a 9-month strike versus hearing from people at UMass Memorial how well they were taken care of during this pandemic. And so this next 3 to 5 years in healthcare and I think in many industries is going to be all about getting and keeping the best people possible. And boy, I'm glad we got a head start here because I think it's going to make all the difference in the world for us.
Well, Eric, I'm really thankful for what you've been doing and what you've been willing to share with everybody here in the audience today. So I really, really appreciate that. And I hope that 2022 will bring brighter days and recovery for everybody involved.
Well, really appreciate the opportunity, Mark, and keep up the great work with the podcast.
Well, thanks again for joining us. Maybe at some point we can do another retrospective looking back. Knowing you, there will be continued lessons learned and reflections, and it would be great to hear from you again at some point.
Thanks, Mark.